Mr. Jackson, a 55-year-old man, presented to the ER with a one-day history of worsening epigastric abdominal pain, nausea, vomiting, and inability to pass flatus. He had a history of gastric bypass surgery for morbid obesity 5 years prior. He also reported intermittent crampy abdominal pain with eating for the past few months. On exam, he was afebrile but in moderate distress due to pain. His abdomen was distended with high-pitched bowl sounds. Labs were significant for leukocytosis of 16,000/mKL. CT abdomen showed dilated loops of small bowel concerning for obstruction and a transition point in the left upper quadrant suggestive of an internal hernia. The patient was made NPO and resuscitated with IV fluids. He was taken emergently to the OR by general surgery for exploratory laparotomy. This revealed a left paraduodenal internal hernia containing ischemic small bowel. The hernia was reduced and the bowel run was resected. His postoperative course was complicated by a pelvic fluid collection requiring IR drainage. He was discharged home after a 7-day hospital stay once tolerating a regular diet. Commentary questions. What are common causes of internal hernias? Congenital peritoneal defects, postoperative changes after Roux-en-Y gastric bypass or liver transplant. Trauma, inflammation, prior surgery can also predispose. How does presentation of an internal hernia differ from that of external abdominal wall hernias? Less visible bulge, more nonspecific abdominal pain, higher risk of strangulation and bowel necrosis due to narrow rigid internal openings. What symptoms and findings suggest bowel ischemia from incarceration? Severe pain, high WBC count, metabolic acidosis, peritonitis on exam, free intraperitoneal air. Why does a history of gastric bypass increase risk of internal hernias? Bypass surgery alters internal abdominal anatomy, which can create potential internal hernia sites. What can be done to prevent internal hernia complications after bariatric surgery? Minimizing mesenteric defects during initial surgery, proper closure of openings created during bypass procedure, timely diagnosis and management if hernia suspected.